I am Agnes Collarte. I'm the tissue viability lead nurse in London area. Mrs. Whatling was referred to the tissue viability service sometime January 2024. She has a large circumferential leg ulceration with producing high amount of malodorous discharge. Her past medical history is hypothyroidism, closed fracture of lateral leg, seropositive rheumatoid arthritis, thyrotoxicosis, and bilateral total knee replacement. Mrs. Watling lives with her husband and relied on wheelchair to go out and about, and because of the extreme pain on the lower leg. Due to the leaky legs, Mrs. Watling felt uncomfortable when she is in the same bed with her husband. So she spent most of the time sleeping in the chair. So her legs is down most of the time, 24 hours a day. On the first assessment, her wound was circumferential, measuring 19 centimeters by 22.8 centimeters on the right leg. This has been present for 2 months. On the assessment, there was edema, spreading redness or cellulitis, high amount of malodorous discharge. There was maceration at the peri wound. The wound bed at that time of assessment was approximately 90% sloughy tissue, soft sloughy tissue, and 10% granulation tissue. Mrs. Watling reported to us that she was in extreme pain, severe pain. Due to her numerous allergies at that time, she was very anxious to try another medication, the painkiller, to increase the painkiller, to try a new dressings because she may react to it and causes more pain and further complication. At that time, she only has cocodamol 4 times a day to manage pain. And that was not enough for her all throughout 24 hours a day. In January, Mrs. Watling's wound on first assessment and few assessments with us, the wound deteriorated because of the presence of infection. She was in a lot of pain. You can guess it's 10. If there's more than 10, that would be beyond that pain. It's 24 hours a day and there was no relief. She came to the clinic just for washing, change of dressings, and nothing more. As a clinician, I felt really sorry because there's nothing I can be of help to her to ease the pain. We know that there is medication, but she can't have that medication because of many factors that would made more problems to her medically. So when I saw Mrs. Watling, I've discussed to her neuromuscular electrostimulation device. I've presented her the device and give her the benefits, what it can do to her legs. It would ease the pain, encourage, reduce edema, and of course, we all want to have healing. When I presented the gecko device to Mrs. Watling, she was a bit reluctant because of the adhesive. Anything new to her skin, she will develop reaction. So I've discussed to her that hopefully she wouldn't react. And I've given her time to think. And I don't want to rush the treatment. At the end of the day, it's the patient. So we've given her 48 or 72 hours. So on her next visit, we'd followed it up again if she's happy to go ahead. When she said that she would try, I think because of the pain that she has been experiencing for more than 2 months, she did try the gecko device. I was ecstatic. I was so happy because I know that the device works very well with a lot of patients that we have in the clinic. So when she started the gecko device, we followed up her at 72 hours again. So we see her twice a week in the clinic. So when I asked her on the following visit, how was it, the gecko device? Her smile, her face was ecstatic. The pain is gone. I can just see her in her face without even telling me that the pain is gone. But I know by the look of her face, it has changed. And when she said the pain is gone within 24 hours that I have applied the device, I was overjoyed. As a clinician, that was a satisfaction for me to help ease the pain and suffering of the patient. And then I asked her if she is willing to continue the device, to put it on. And she was happy. And she could not stop because there is some help and there is some hope for her with regards to the pain. And because the pain is gone, her hope now is to lessen the level of exudate and hopefully healing of the wound. Over the next 10 weeks, the wound, or even 4 weeks, the wound showed remarkable progress. It was reducing in size. The level of exudate decreases to the point where she was able to sleep in the bed with her husband. That's amazing. Due to the reduction in her pain, she could mobilize with the use of 2 sticks instead of using wheelchair. And again, we see that progress in the clinic. She was able to tolerate the high compression bandage instead of reduced compression. By the end of the treatment with the Gico device, the ankle circumference reduced to 21.5 centimeters and her calf is 33.3 centimeters. The team, the patient, and I were amazed at the improvement in Mrs. Watling's wound after adding the Gecko device to her treatment regime. After 10.5 weeks of treatment or using the Gecko device, the wound continues to reduce in size, and it was measured 2 cm by 2 cm. However, Mrs. Watling developed a mild skin irritation. Hence, the Gecko device was stopped. However, because the wound is healing and she used it for 2 months, and we know that it is reducing in size day by day, we have to stop the Gecko device. Sometime in May, the wound completely healed. I was ecstatic when I heard the news. She phoned the department to inform us that the wound has completely healed. We were very happy. And being a clinician for 20 years of experience in tissue viability, I did not expect that the wound would heal in a short span of time, knowing that the wound is circumferential with infection and a lot of comorbidities behind. I would not expect the wound to heal. I was overjoyed with the result of the Gecko device. And we've just seen her the other day, for repeat Doppler assessment. And the legs is amazing. There was no break. She continued to use the garment, the compression garment, to prevent recurrence of leg ulceration. I have so much faith with this device. It's new innovation. I know it is new, but I have so much faith that I would love to share my experience. The result that we have in the service or in the clinic is a great result. And I wouldn't be much prouder to say this device works miracle to the patient. Thank you for listening. You can read or download the case study in the First Kind website.